We're talking sleep on the show today, specifically not getting enough of it or not quality sleep. Sleep apnea is the hot topic, and many of you getting in touch with questions and concerns. So we're bringing in the ENT. Dr. Issam Alakchaka is with us. He's a consultant ENT surgeon at Al Zahra Hospital. We've stolen him away from theatre to answer my questions and yours about sleep apnea. Dr. Issam, thank you so much. I wanted to ask you, medically speaking, what is exactly happening within the nose, the throat, for it to be called sleep apnea compared to someone who just snores a bit at night?
Yeah, good afternoon. Sleep apnea actually is something happened that your breathing is stopped for more than 10 seconds when you are in a normal sleeping. The difference between the sleep apnea and the snoring is only a sound produced by the soft tissue in the throat and the palate. But sleep apnea, it means that you are not able to breathe, you are not able to inhale the air through your chest because there is obstructive in the airway, or there is another kind of reason which is rare happening, which is central. It means that the brain doesn't give you the order to breathe. Wow. And that's something else. But our concern is what we call obstructive sleep apnea. It means that you're trying when you are sleeping to breathe, but the air doesn't reach to your lungs because there is a blocking in the upper airways. That's what briefly the sleep apnea. Obstructive sleep apnea.
We've heard earlier from Layla just how dangerous this can be, and she sadly lost her own mother when that sleep apnea wasn't diagnosed. I wanted to ask you about risk factors, about demographics of people that need to be particularly clued in to their sleep and their sleep patterns. Is there a group of people that this affects more than others?
Yeah, actually, in general, males are more effective than females, around 3 to 1%. It's not like a demographic, but it's more probably it's like ethnicities. They found that in some research and statistics that, for example, the African American is a higher percentage for getting this obstructive sleep apnea than the Caucasian. And there is always the age has a big role. For example, over 50 years old, especially for men, and over the menopause age for the women, they can get the chance to get this obstructive sleep apnea. Actually, the percentage globally for this disease is getting higher and higher, maybe because the obesity getting higher and higher, and you will see now the obesity is one of the main factors of this. Or the doctors start to search more about the disease. Mm-hmm. So now recently, the last statistics for the percentage of getting this disease from the population is more than 33% of the men. That's and that's huge. It's a very huge number.
A lot of tired people out there.
Yeah, and as I told you, maybe because the people get aware, maybe the doctors get aware, we learn a lot about this disease, and the higher percentage of obesity these days, as you know, it's getting higher and higher these days, that the number of patients who are overweight or obese.
Dr. Issam, we've had a lot of messages on this now. Some people sharing their experiences and questions as well. Sammy's saying, I was overweight for many years and suffered with sleep apnea. I had to wear the machine over my face, the CPAP. However, last year I had a gastric bypass. I've lost a lot of weight. I'm eating better, exercising, and I no longer need to wear my machine at night. Good to hear a positive story. And Sarah asking, does that CPAP machine always improve sleep apnea? Are you able to explain how that machine works and who is a suitable candidate for it?
Yeah, actually, this machine, which called I will not mention that the CPAP, I mention the PAP, P-A-P, because CPAP is one kind of this machine, which means continuous pressure airway. But we have another kind with the same function. The target of this machine is that when you are breathing during the night and your muscles is too much relaxed and the blocking happens, we will give you during the inhalation phase some pressurized air that can open this collapse. I always make an example for the patient, like you have a very soft straw and you need to suck a thick liquid from this straw. It collapses as there is a physical law, Perloni law, that the walls of this pipe will collapse if it's too much soft. So we give additional power to make these walls of the airway a little bit harder, that prevents from collapsing or prolapsing. That's what the machine did. But actually, when we want to use the machine, there will be a full study of the patient, Because in general, only 50% of the people, of the population who are suffering from the obstructive sleep apnea, they may be compatible with the machine. Another 50%, they don't tolerate. There is another factor that we can treat. I would just want to highlight something. Like obstructive sleep apnea is not only one factor. It's like more than 10 or 12 factors. Not all of them maybe exist in one patient, but we need to focus and to highlight which factors this case is suffering from that we can control. Obesity is one of them. As I told you, the age, the shortness of the neck, the width of the neck, the shape of the throat, the size of the tongue, the nose function, and even there is, like, as I told you, there's some like family or genetic factors may affect this issue. So we need to study case by case and to find the suitable management plan for each patient separately from the other. It's not like a standard solution for all the people that use the CPAP and you'll be fine. It's not like that.
No, I think that's really good to hear, because I think a lot of people have thought of it as being this magic bullet, really.
Yeah.
And I wonder, people that do use it, is the body going to respond in a way that it's going to cure itself? Is this a long-term strategy? What other techniques do you feel like can be really effective? We've had Jim asking about mouth taping. What's your thought on that?
Yeah, for example, if we have like this patient who has a lot of factors we cannot control, like he is too much overweight and there is no way to lose the weight. He has, as I told you, like a very short neck, and surgeries cannot make any changing for his, and he has very high number of this sleep test, what we call the AHI, which is very like important number for us to treat the patient. The CPAP will be the only way, and of course, when you use the CPAP, we need to continue observing the patient, how much he's responding, because even the machine itself may get us like a record or report for this 1 or 2 months of sleeping with or without, and then we will find out if he's responding. And this machine is part of the management. As I told you, it's like a long trip, starting with the sleep test and starting with education for the patient and checking out what's the reason of his sleep apnea. And then we can figure out the way how we control it. One of them is the CPAP. There is another ways like surgeries, like a sleeping position, like losing weight. There is a lot of factors that we need to modify to control the quality of sleeping for this patient, which is very important to prevent him from complication, which is serious complication, mainly the cardiovascular system complication, which may happen because of sleep apnea.
Can I ask you about sleeping position? I think that's a really interesting point, because there's been all sorts of weird and wonderful inventions over the years. People sewing golf balls into their pajamas to stop them lying on their backs and things like that. What can actually be effective with stopping snoring? And I'm not talking about serious sleep apnea here, but perhaps just having a silent night.
Yeah, that's what I am doing. Some patients visit to me, they, for example, have like a plucking nose on the right side. So without they are explaining themselves, always I tell them, you are always supposed to sleep on your right side. If you sleep on the left side, on your back side, you'll feel too much bad, and you will start snoring, or even will get some like this breathing difficulty. He said, yes, doctor. Why? How you know that? Because we have like a positional effect for the nose, for example, if you are taking the nose. If your nose, right side of the nose is blocking by the deviated septum or whatever, or anything blocking the nose, when you sleep on the right side, already it will be blocked by your position. So the left side will be free, and you can sleep all your night better. If you sleep on the left side, and because of the physiological effect for the position, your left side will be blocked, and your nose right side already blocked because of the bone or the cartilage, whatever. So you are not able to breathe from the nose. And if you sleep on your backward, both sides will be a little bit stuffy, so you'll suffer. So always we teach the patient, you can put like a tennis ball behind your back or a pillow, small pillow, and sleep on that side. That when you are in deep sleeping, it prevents you to change your position, and that will help you to get rid of this mild sleep apnea or mild snoring.
This is great information, because my husband has no air going in on his right hand nostril. In fact, I'm going to send him to an ENT very, very soon. Yeah. He's wearing those awful, really ugly nose turbines. I go to bed wearing my Invisalign. He goes to bed wearing his nose turbine. And I was like, well, this is marriage. This is where we are in our 40s.
Yeah, but we can fix this. That's we tell the patient if he refused to do like a surgery for his nose, because nose always can be fixed. Blocking nose always can be fixed.
Expect a phone call from Mr. Farmer. Dr. Issam, thank you so much for your time today. Really good to get an overview, and you can be found there, consultant ENT at Al Zahra Hospital. Take care of yourself and your patients as ever. And we will be, of course, revisiting this topic, judging by the number of messages we got. A hot one indeed.